Hello, everyone. Welcome back to another amazing episode 52 Authors, 52 Weeks. Today, I am joined with Teresa Lacorazza, who is one of many authors in the book titled Holistic Mental Health. How are you?
I am fabulous. Thank you for having me. I'm excited to be here.
I'm actually so excited for you to be here because when I read your chapter in this book, Embodying Gratitude, it was something that really resonated with me as something that most of us don't do. And we'll talk about your story shortly, but gratitude for me is a must do daily, right? Now, are there some days where you're like, right? Because you're human, but practicing gratitude and something I started doing, and I don't even know how I started doing it, why I started doing it, but I just started waking up in the morning and opening my eyes and just simply saying, "Thank you, God, for another day." That's it.
That's it.
Thank you for another day. And maybe someone says, "Well, I don't believe in God." Well, just thank you for another day. Thank you for being able to open my eyes, put my feet on the floor, and walk about my living space, and I'm breathing. I'm not in the casket, right?
Yes. Yes, exactly. I like to
So,
think of it
oh,
as, you know, being the painter of your life. Like, okay, so today, what am I going to use? I think maybe I want to use watercolors today, or maybe I want to use pastels or just charcoal, make it just black and white, like black and white, depending on what you have going on that day. Maybe it's just a very black, it's either going to go this way or it's going to go this way, or I have to do this or I have to do that. Right. Or let's fill it with magic and have watercolors like all blend together.
I love it. So before we get into your story, which is, listen, folks, you may need to grab a tissue or two because I actually read your chapter. It was one evening I was sitting here. I usually have about 5 or 6 books that I'm trying to get through. And so I was actually very thankful that I only had to start with your one chapter, which then prompted me to go back to the other chapters. But we're going to talk about some topics that every household needs to know. So if you're watching this episode, get your friends, families, frenemies, get all of them to tune in because we're going to talk about some need to know topics for every person in the human race.
Yes.
So tell us, before we get into your story, just tell us about a little bit about you. I know you moved from Maryland to New Jersey, and it's so funny because I can hear a little New Jersey accent. So I don't know if that happens if once you move, but tell us a little bit about you personally and what you do for a living before we get into your story.
Sure. Well, actually, you probably hear the New York accent. My husband and I met in college in St. John's University. I was born and raised in Queens. My husband was born and raised between Manhattan and Brooklyn. And because of his job, we relocated to Maryland for 7 years. And then from there, we moved back up north, and we're out not too far from New York City. He works in the city, and we are in New Jersey now. So that's why you definitely hear that. And I definitely stuck out like a sore thumb down in Maryland. People are like, you have such an accent. I'm like, I don't have the accent. You have the accent.
That's what they say about folks from Chicago. They're like, you have a Chicago accent. I'm like, well, because I travel a lot, I'm just like, this is just the way I talk.
Right.
It's just my verbiage, right?
Right. Right. I feel you. I feel you on that one. So I am a holistic arts practitioner. I study a lot of and I teach a lot of different holistic modalities. I'm an EFT practitioner, which is emotional freedom technique, also called tapping, that a lot of people are starting to learn about. I use things like that and visualization, use learning and how to use positive affirmations, and just learning where your blockages are and learning how to approach them and eliminate them. And I always, always, always start with gratitude. That's gratitude is the first place for any kind of healing that you need. And that's really how that chapter was born.
I love it. You know, it's funny that you mentioned that a lot of people don't know about the different therapies. And at 51, I realized there are so many different therapies that I don't know about. Like I read about, and I'm pretty sure it was covered in this book about Reiki therapy, right? So now I'm like, okay, I've spent money on my entrepreneurial efforts, but now I must spend some money. I want to do some wellness retreats where I
Mm,
can do some meditation and yoga and Reiki therapy, just all the things, because at this point in my life, I am all about that inner peace.
yes,
Because as you age, you're going to be dealing with things like I told you, I'm in this menopausal state, right? And there's some anxiety that comes with
yes,
menopause. There's the weight gain, there's the emotions, right? And so I am really big on finding my center and staying there. And that has really caused me to reevaluate relationships and
yes,
situations and things, because I don't need all of those things in my space when I'm trying to deal with, what I'm dealing with. And I prefer to be in this place of peace. It's a
yes.
nice place to be.
And and everything is a choice. You know what peace feels like, and you know what havoc feels like. So every morning you could choose. Do you choose peace or do you choose havoc? I've been teaching meditation for many, many years, and in town here where I live, I taught for about 3 years. I was teaching senior citizens, and they would come. They were the best. I love senior citizens. They would come in and they'd be like, "I can't do this." I'm like, "Just promise me that you're going to just listen and just be open."
Be
And they would
open.
say, yeah, just be open to it. Like, you may think it's hokey pokey. You may think that it's woo woo. It doesn't matter. Just be open. And even if you're just sitting here because you have nothing else to do, just be open and just listen and try. And I've taught thousands of people how to get into that space, because as Wayne Dyer called it, it's the space between your thoughts. And that's where all the healing happens. That's our bodies are meant to heal itself, right? And that's where it happens. So we need to learn, and it's like a muscle. The more you practice getting into that space, the easier it becomes. So the quicker you
Absolutely.
can find peace.
You know
Right?
what? That's so true, because I have asthma. And one of the things that my aunt, she's a nurse, but I was in the emergency room one day, and I was kind of like near this hyperventilation state, right? And she was like, when you're having, and I got adult asthma from asbestos. She was like, when you're having your asthmatic episode, I want you to just learn to take these deep breaths. And so when I first started learning about meditation, and I was listening to one on my Peloton app, and it was like they were guiding me through the steps, and when they would say some things, I would say, "There's no way I'm gonna feel this, right? Feel it through your body, feel it through your." I didn't think that those things could happen until they started happening,
Right.
and using it when I'm feeling overwhelmed and just allowing myself to calm down, center myself, and just
Right.
let it all loose. It is so you can feel it in your toes.
You can. That's the beauty of it. That's the beauty. And for all you naysayers out there, I promise you, all you need, the first thing you have to do is just make the commitment that
Mm.
you're gonna work at it.
And be
And
open. Be
yes,
open.
be open. Even if you're like, oh, I don't believe this nonsense. You know what? Just just be open and be like, I may not believe this, but so many other people are finding peace inside. That yes, you need to give it a try. You have to be open and be willing to, step aside, as Wayne Dyer says, again, I love him. He was one of my favorite teachers. Ego is edging God out. Like, just
Mm.
put that aside and just and just try it, because something that's so simple can and will make the most profound impact on your mental health, on your being. And it's
And
so
it's free.
important.
It's free to meditate.
Right.
I mean, winning, right? And you know what?
Winning. I love
What
it.
I have found, meditation, it takes practice, right? To stop all of the noise. We have allowed so much noise in life to hold us hostage.
Yes.
The cell phones, the TV, right? All of these things that are taking us away from our place of center. If you just take the time, and I found I have to have a place, right? So I didn't tell you this before, but I have a special needs daughter. She's 32. She's deaf. She's nonverbal. And so she doesn't live with us. She comes home like once a month or so. And in her room, there's a rocking chair. And so there's no other distractions. And so oftentimes I'll go in there with my book and just sit and rock and read. And I never knew how powerful that was. But what I did know, she loves to rock. So she has a rocking chair here. She has a rocking chair at her house where she lives. She has a rocking chair at her day program. She's has always been rocking. And I realized it was so very calming for her. And so now I've adopted that place where I can sit and read my book. There's no TV. There's sometimes I'll plug in a little Alexa thing and let some soft music play. And
Right.
I'm just able to let all the things just fall off my body and just hit the floor. And I feel so light.
Isn't it amazing? It's also what I've been learning over the past year, somatic exercises. So the rocking is like the rocking when you're pregnant, right? The baby feels that, right? When you hold a baby, what do you do to soothe it? You rock it. So it's that motion that takes you out of fight or flight mode.
Yes,
And that's
yes.
when you will feel like things will fall away, fall away,
You know
fall away.
what? So something just hit me because in healthcare, I do some medical record audits. I wonder what impact meditation would have on mental health patients.
I can somewhat answer that question for you. There was a study done. I want to say, because I feel like COVID put me at a time warp, maybe about 15 years ago, somewhere around there, recent enough, but not too far off. And it was done, maybe by Yale or Harvard. And they took 30 people and they did brain scans before and after. And these 30 people had to meditate for 30 minutes a day for 30 consecutive days. And what they found was at the end of the study that the gray matter of their brain grew.
Wow.
So now there is science backing up, all this metaphysical stuff. There's actually tests that have been done, and that's not the only study. That's the one that I learned about. There are other studies that show that yes, it actually does. And they also have shown that meditation will lower your heart rate, will lower your blood pressure, different things like that.
And
So
we need
it
that.
has, yes, we do. So there is that mind body mental, that mind, what am I missing?
Mind, body,
Mind
and
body.
soul.
Hey, thank you. My goodness. The mind body soul connection. It really is. It's becoming more apparent to more people. More people are open and willing to try different things. I love Reiki. Reiki is such an amazing tool. When you go, you can't explain it. It's amazing. So there are so many different things out there. And yes, in that book, there are every chapter has something to teach. So you get a little bit of this and a little bit of that, and you can find and really look through and feel what resonates with you.
Yes, yes. So speaking of body, let's shift gears a little bit, and this is where this is going to get a little heavy. So when I read your chapter, you tell a story about you discovering that you had a form of cancer. And so, one of the things that you and I both feel very passionate about is
Yeah.
making the appointment for the appropriate test. I remember, and don't judge me, I was excited about getting my colonoscopy, right? Because I want to know. I don't want to be walking around with this in my body. So I believe in prevention. Now, my husband, on the other hand, I had to kind of twist his arm to get his scheduled. But I'm like, hey, my grandfather is currently 103. His
God
parents are in their
bless.
80s. My parents are in their 70s, right? So I got a lot of people who need me, but I got a lot of life and lives to change, and I can't do it if I'm in a casket. And
That's
I
right.
personally believe that holidays, get togethers, that's when you need to have the conversations about going to get the mammogram, going to get the colon screening, going to get your PAP exam, your prostate exam, because that's when you got folks' attention, right? Because they're in the space and you can have those conversations. I like to have the conversation about knowing your family history.
Right.
And knowing your family history doesn't mean that you're not going to get something, but it does help your clinician understand that you are predisposed to certain things. But you could have a zero family history in something and it happens to you.
Yes. Yes. That's my
So,
story.
what would you say to that woman who says, I don't have the time to get a mammogram?
I would say, then do you have the time to be dead?
Mm, Tell us more. Tell us more.
So I had a few lumpectomies over the years. And I guess it was about 2015. My surgeon had told me that I had abnormal cells in both of my breasts. Those cells don't turn to cancer, but it puts you at a higher risk for cancer. So I needed to be followed every 6 months. I was like, okay, I can do this. I was good with that. Um, and that's when we were living in Maryland, and my surgeon was in Baltimore, and I would go see her every 6 months. I had a mammo once a year, then started having also MRIs. We ended up having to relocate to New Jersey for my husband's job. Went to the place to get my mammogram down in Maryland because the place was amazing. It was one doctor, one space. It was like a spa. I had my results. She would call you into her office, put up all the screens, show you everything, explain everything. I knew I wasn't going to find that up here. And I didn't want to go into a hospital to have my mammograms. It was just a psychological thing. Like I just didn't want it. Well, she ended up selling her practice. So in my mind, I was like, well, I don't want to go to somebody new all the way down there. So I need to find somebody here. And of course, I procrastinated. I put it off. And then COVID happened. So, everything was shut down. And I was having a conversation with a friend of mine. And she said to me, you better go because I don't want to see you in a casket. And that sent chills up my spine because no one had ever said that to me before in that way. And she said, do you want your kids looking at you in a casket? And I was like, oh my God. So I did some research. I finally found a doctor. I called to make the appointment for the mammo and for the appointment to see him. And I'm hysterical on the phone as I'm calling because previous to that, I started having nightmares, waking me up in the middle of the night that I had cancer and it was too late. Now, there is no breast cancer in my family. My paternal grandmother had it, but she was in her 80s. So they don't even really take that into consideration. I have a sister, I have a mother, I have aunts, grandmother, a maternal grandmother. Nobody had breast cancer. I didn't think. I was like, okay, no, I have to be more careful. But, I cut soy out. I was trying to watch, certain things, you know, cut out processed foods. I end up going for my mammogram and I go see the doctor and he walks in. He must have been told, you got some crazy lady coming in. So just beware. And he says, oh, we're here to talk about your normal mammogram. And I just started to cry. So we talked a lot about different things about, losing some weight and this and that. And I gave him my whole history. And he says, I'll see you in 6 months. And I went back 6 months later. And I had a rash on my nipple. And he said to me, how long has that been there? So I'm like, what? And he's like, that little rash, is it itchy? Do you feel? I'm like, I didn't even know it was there. So he gave me a cream to put on. He said, come back in 2 weeks. And he said, if it's still there, we're going to do a biopsy. And I'm like, biopsy? What are you talking about? So,
a rash, right? It's a rash.
Right. He's like, oh, it's usually like eczema, something skin related. I go back 2 weeks later and I just had a knot in the pit of my stomach. Like I just knew. And it turns out that it was a really rare form of breast cancer. And I was devastated. I was completely devastated because there is no breast cancer in my family. So I was very lucky. It was caught very early. They removed about 25% of my breast, including my nipple and my areola. They took a few milk ducts that were covered in cysts. Thank God there was no other aggressive breast cancer inside my breast. They made sure of that first. So I am cancer-free. Thank you, God. I am cancer-free. But had I not gone and made that appointment, I would not have known, especially because it was a rash. Most women will not equate a rash on the surface with breast cancer. And when I spoke to my GYN, and I've been going to him since I'm 21, he called me and he said, had you come in to see me, I wouldn't have thought anything of it because I would have thought it was something skin related. In all the years he's been in practice, he never had a patient that had Paget's disease.
Wow.
So I really, and I became very, very open and transparent on my social media, the good, the bad, and the ugly, the days that I cried, the days, my first day of radiation. I didn't need chemo, thank goodness, but I did have to have radiation. My first day of radiation, going there, and the tears and the fear, right? I was like, I got this. Yeah, 100%. I was like, I got this. I processed this. I'm good. I used all of my tools. They call me to walk in the room. I walk in the room and I see this big, huge machine and I get hysterical. I'm like, oh, maybe I don't have this the way I thought. But I made it through. I'm here. And
you're here. You made it through because I can see you.
Yeah, right. And it, my parents are in their 90s and telling them that I had cancer when they knock wood, they've never had to deal with major illness like this. And I'm the youngest of four. So for them, it was what, and then telling my boys, who one was going off to college, the other one was a senior in high school, telling them that was really, really hard. And, my husband he was like, we got this. Let's just do it. Let's move ahead. But my message really is, please go, because cancer is so much scarier than the doctor. So much scarier. Go. And if you get a diagnosis, go talk to another doctor. And I'm glad that I did that as well. I ended up getting treatment at Sloan Kettering Hospital. It felt right for me. I do. I get choked up about this because I am so grateful. And I teach my gratitude practice in my chapter because gratitude is really what got me through that time.
That time. Wait, because we cannot tell them everything that's in this chapter because they have to buy their own copy of the book. I have read your chapter, so I will just highlight a couple of areas. So you talked about Paget's disease. Folks, if you don't know what that is, look it up. My grandmother grew up in a time where the doctor is always right. And I believe in 2024, it's about having that relationship with that doctor that you're seeing, but also going with your gut
Yes.
when you're like, maybe I need to get a second opinion, right? Maybe this facility is not the place that I'm going to be able to get my healing. But when you talk about put your money where your mouth is, it's time to practice what you preach. As a therapist, as a coach, believe it or not, we're teaching others these techniques, but at the same time, we're constantly reinforcing it with ourselves, right? Because you got to encourage yourself first before you can encourage others. But the journey when you were diagnosed with the breast cancer, that wasn't the end. Your chapter demonstrates the power of resilience because you got the diagnoses, but then there were some other things that happened in the house that was like a 1-2 punch. I was like, wait a minute. I'm like, how did you get this in this one chapter? As I was turning the pages, and let me just tell you, because I was underlining things. I was just like, what? What? Wait, another thing? But what I like is you were honest in your account of what was going on, how you were feeling. I think a lot of times, especially we as women, we put this mask on and we let the outside world think all is well when all is not well. And
Right.
it's okay not to be okay, but what are you going to do about it?
100%.
And there's help, right? There's help.
Yes.
And again, some of these techniques that we're talking about are, as the kids like to say, free 99, right? You can meditate, you can journal, you can do all of these things to help get a cleaner insight. I think there's this heavy focus on clean eating, but what about that other aspect of internally cleaning out negative thoughts and feelings and
Purging of the
emotions, purging
purging
it,
of
yes, detoxing those things.
yes. Yes. And what I've noticed and what I've really tried to practice over the last several years is when something comes up, when I feel something, to identify it and give it a name. Is it anger? Is it frustration? Is it sadness? Is it joy? Even the good things. We don't have to only do this for the bad, or when we're not feeling right. What is it? Give it a name and allow yourself to feel the feels. Because if we ignore, I'm angry at this person, I'm angry about this situation, but anger is not good for me because it doesn't make me feel good. So let me pretend, let me push it under the rug. Like when you have, an issue with a friend or a partner or a spouse or a child or whatever it is, you push it, doesn't heal it. You need
Doesn't go away.
It doesn't go away. You have to allow yourself to feel the feels. And, if it is something where you feel sorry for yourself, I've done this a million times. I'll set a timer. I'll give myself 2 or 3 minutes. Like your pity party, that's it. Cry, yell, scream, feel bad for yourself. When that timer goes off, now how are we going to address it? How are we going to get rid of it?
Put your money where your mouth is.
Right. And that's what God said to me, between the cancer and then the house. He was like, okay, so you've been teaching this for years, young lady. And now you're going to have to put your money where your mouth is. And you're going to have to use the tools that you've been teaching everybody else for so long. Because again, what makes us better teachers? When you teach from experience.
Absolutely. You know what? I realized that my story with raising a special needs daughter, being a single parent, just all the things. The day I took the 30 pills, right? I realized that I didn't go through that for me. I went through it so that I can help someone else that may not have been as strong as me, right? Because I've lived to tell the other end of the story. I'm on the other end of it. And so our stories help us, but they are helping so many other people. When I hope, I hope that someone that's listening to this goes to 5 other people and say, have you checked your breast today? I think we're so infatuated with the look of the breast that we don't take the time. And I'm guilty as well. Like I get my mammogram every November. I don't go in October. I go in November because I want all the folks that are going to rush in for October, they can go. I'll do November. But taking a look at your body, because you're the one that sees your body every day. You're walking around with it. And
Right.
you would think, oh, it's just a rash. I'm just going to put some cream on it, when it could be something bigger. And I think that's the missing element. We're not in tune with our own bodies. Like, if you have an ache and a pain, but something as a rash that may or may not be itchy, you may ignore it. And it could be
Exactly.
something larger.
And I definitely would have done that because I never would have equated, you know, breast cancer with a rash. And it literally, if you took one of those, those old Bic markers, like if you took a red one and put 3 little dots, how like sometimes on the paper it would bleed a little. That's what it looked like. And a little bit of flaky skin around it. That
Wow.
was it. So, and I didn't notice it because it wasn't itchy. It didn't bother me. I wasn't even aware of it. And I was like, I don't know. I don't know how long it's been there. Now he had checked me 6 months before, so obviously it wasn't there then. But and I remember just being like, cancer? What do you like? Wait, what are you talking about? And it was really, it was just so mind blowing for me that I'm like, look, it's not my family, and I don't have the gene. And the doctors were like, most people don't. I'm like, oh, okay, well, I don't have that. And so it was really, really, um, it was a ride. It was a ride. But I just said this the other day. People think I'm crazy because I say I'm grateful that God gave me cancer because I learned so much, and I'm so much of a different person. And in some ways I'm better. And what do I mean by that? I wasn't a bad person before. What I mean is I'm better because I know who's there for me. I know who's not. I know how to ask for help. I know how to say no. Women, I feel, struggle with that.
Absolutely. And no, it's a complete sentence.
Yes, it actually it is. It really is. So learning to ask for help. On the days that I had to go for radiation, I had so many people say, "Oh, I'll drive you. I'll take you. What do you need?" And I remember one day I called my next door neighbor. I said, "Hey," I said, "you want to drive me tomorrow?" It wasn't far from the house. And my husband's like, "What are you bothering her for?" I said, "Well, she offered." And we had some of the best conversations on the way to the hospital and on the way home. If we talked about cancer, we did. If we didn't, if we talked about the kids, it didn't matter. Because for me, I knew as soon as I walked out of radiation, I got in the car. I was like, oh, exhausted. Now, some people would get exhausted at night. Everybody's different. But I learned, you know what? If someone wants to drive me, I'm going to have them drive me.
It's
Why not?
okay. It's okay to receive, right? And I think
Yes.
you're like me, we're givers, right? And so sometimes when you're a giver, it's hard to receive. But if you allow yourself to be vulnerable, there will be some great things that will come out of that experience, but you have to be open.
Yes.
You have to
Yes.
be open. You
Yes.
have to schedule the test. And I also want to say, a lot of people will say, well, I can't afford a mammogram. there are resources out there for
Yes.
free mammogram screening. So that is not an excuse. The mountain is you. You have to move the mountain and make the appointment and go to the appointment and stay
Right.
in tune with your mind, body, and soul.
Right. Had I not gone to that first appointment after missing, I guess it was maybe 2.5 years of not seeing a specialist. Had I not gone that December, I wouldn't have had the appointment for June. Who knows where I could very well be 6 feet under the ground right now,
Mhm.
or I could have been facing a much more difficult cancer journey. Maybe I would have needed chemo, something much, such harder to deal with. So I am really, really fortunate. I'm really, really that I had that friend that said to me, I don't want to see you in a casket, and your kids don't want to see you in a casket.
And your husband. I
Yes.
mean, because just from the 3,000 words that I read, you have a supportive community. I mean, the folks that came over to help you with the house, we're not going to tell them anything else. They need to get the book, but the community that rallied around you is a testament to the fact that community still works
Yes.
if you embrace it. And I think during the pandemic, because we were stuck at home, we got outside, we got to talk to neighbors. I mean, we've been here for a long time, but we got to actually talk and communicate with neighbors. And that just reminded me of my childhood days when everybody on the block knew who you were. They knew who your
Yes.
mother was, right? So you couldn't do anything. And I think we have to go back to those days because we need each other to survive.
Right.
So listen, our time is up. I want everyone to purchase your own copy, Holistic Mental Health. And wait, I gotta put on my accessory to read the bottom part because it's kind of small. Calm, clear, and in control for the rest of your
Your
life.
life. Yes.
I really enjoyed reading your story. I'm climbing my way through the other stories because I am doing 52 authors, 52 weeks. So
Yes, I love it. I love it.
lots
I
of
love
books
it.
that I am reading. I'm in the process of writing my second book. I can't wait to release it. And actually meeting all of you has really shifted how I'm going to present my next book because I've been having visions of the impact that it's going to have. And when it hits the market, I want to make sure that it's right.
It's going to be right, and it's going to be amazing because you're putting it out there, and your vision is just going to continue to get clearer as you go on.
Yes, I believe in writing the vision and making it plain. I believe in that. So, where can our listening, viewing audience get their own copy of the book? You got some signed copies? I really feel like I need to send mine in to you. I wrote in it, but to get mine signed. But where can our listening, viewing audience get a copy?
So they can email me, and I will sign it and send it to them. They can email me at Teresa, Teresa, at healempowerandlove.com.
I love it.
Yes. And I'm selling those for $25. That if you're within the local United States, the continental United States.
50. Well, those two that's off far away, it might be a little extra.
that will include shipping. So, and just write a little note to me when you saw this wonderful show, and I will get that book out to you in a couple of weeks. And I will gift you a copy of volume 2. I'll sign that one and send that to you.
Yes. Well, it has been such a great time seeing you face to face. I really enjoyed your journey. I appreciate you for being a part of 52 Authors, 52 Weeks. Everyone, until next time.